This health center in Lim and Katagum is large and proud. It sees thousands of patients every month and needed deployment of 8 midwives to care for pregnant women and children. Last year, the total number of midwives deployed here fell to 2. It's Easter holidays and none is here to be found. They are away on Easter break and workers left behind can't guarantee anything.
For the first 1 year, I don't know whether if they get only, I think they get only 2 months allowances.
So how were you able to make them stay?
We are just using our own resources to at least assist them,
And they are okay with that.
and they are okay.
So
They are managing. They are managing.
they
They are managing.
the midwives were supposed to be the skilled attendants deployed to rural health centers under the Midwives Services Scheme to help push down the number of women who die giving birth and their children. Under an MOU from 2009, all 3 tiers of government should contribute to their stipend, while the council government provides accommodation and the state government hires them after the deployment is over. They mind night shift. Without them, Ahmed and 3 community health extension workers are all this center has. Months without pay has led to disillusionment, and the state of Bauchi, one of the first to adopt the scheme, admits that.
Bauchi State have been paying consecutively for quite a while, but there were some times where the funds were not paid and they had to be paid in arrears here and there. These are all bureaucratic issues, but we know the importance of the midwives, and even if they are not paid this month, I assure you that they will be paid what they are due, even if it is in arrears. That's regarding the payment of the midwives. And another issue that always comes up is the issue of local government paying their own counterpart fund.
Midwives attempt to have the best relationship with women they work with, helping mothers go through pregnancy and give birth as safely as possible.
Wani dai ina zuwa wurin sabila da ana binciken lafiya. Ina zuwa don san abin da nake ci. Suna da ƙoƙari, sun iya karɓan mutane. Idan ka zo aihuwa, suna maka mutunci, suna karɓan ka a cikin lumana, ba su da faɗa, ba su da hayaniya. Muna jin daɗin aiki da su.
But that rapport is unraveling, not just here, but far into rural Bauchi. 100 kilometers away, another health center in Bara, Kirfi local government area, is struggling to hold on to its only midwife. She is not available away on Easter break, officials said.
The way we manage them stay is we encourage them that the state government will absorb them after they have finished their assignment, let them exercise patience, and the federal government will look at their complaint. So that is how we normally encourage them. And if there is some any workshop, we just send them so that they will do something. That is how we encourage them, because in this facility there is no way to get any extra money because we are running DRF here.
Initial arrangements were to have state governments take over the program after federal government paid for 2 years. The federal government is reluctant to categorically say the scheme has ended after 5 years, but it blames state and local governments for failing to keep up their ends of the bargain. Bauchi State knows the scheme has ended and is looking to put up a new one, this time around between the state and local governments.
Perhaps the only thing we may do differently is to critically look at the allowances. Now it's only the state government doing that on its own. So it may not be able to take on the full responsibility for the enumeration to be as equal as it used to be. So we are really going to look at what is obtainable, what can be given as enumeration to these midwives. But other than that, the basic principles will certainly be the same as it was initially, and also the issue of supervision, linking the facilities to a general hospital, all those guidelines of which were followed in the operationalization of the MSS scheme previously will be adhered to. So when we start and we see that there are areas that need to be modified, then we will do that accordingly.
Are you optimistic that you can get that the support of the local government areas or councils would uh, be there for the MSS for Bauchi State when it does begin?
Yes. We have already started intimating the various local governments that we have these midwives at hand and this is our plans for them.
Bauchi's new scheme has meant opening its doors to employ health workers. Hundreds have served and are in line. At least 51 have reported to be verified. Only 11 of them are midwives. If people are not responding as enthusiastically as you would have expected, would you be willing to throw the doors open to midwives from, say, other states, for instance?
Of course, our doors are wide open for midwives from other states. Even these ones that serve under the MSS, they are not from Bauchi State, but we are going to absorb them. And if you have midwives from other states, we are going to absorb them. This is for our mothers' health. So I think any midwife that is qualified come to Bauchi State, will interview her and will absorb her into our service.
The relationships midwives have had speak for them. The people they worked with are helpless but hopeful, even though nothing is in their power.
Yes, we want them to continue. Even if they are, even the government will help us small amount in our salary to pay NSS, we want that.
You would want that?
Yes.
How much are they paid now? How much are they paid now?
They said local government, I give them 10,000, state 10,000, and the federal 20,000, making 40,000.
But you would be willing for the government to remove a little from your own money and give to
Yes,
them.
yes.
Why?
Because we don't have enough staff here. That's why MSS are helping us. That's why we want that.